Life, this black star took it to another level, and I'm chasing a dream called mainstream.
Hey, what's up, family? And thank you so much for tuning into the channel. So today marks 1 week from my laparoscopic hysterectomy. So in this video, I'm going to share information around the following topics: energy levels, your first doctor's appointment, the size of my fibroids, as well as my uterus. We'll talk about pain medication, discharge and bleeding. I'll show you photos of my sutures, or my scars that I have. And then we'll talk a little bit about driving, travel, constipation issues, exercise, sleep positions, and much, much more. So without further ado, let's dive right into it.
This music was created for this culture need a whole lot.
So if you've been following me and watching the other videos leading up to this one, thank you so much. If you have not, please go back and check those out. So you can tell, if you have been watching and following, that my energy levels are up, like whoop, all the way up. Okay, I feel amazing from the neck up. I'm still healing and recovering. Like, don't let that fool you. But I feel great. I feel amazing. When I woke up this morning, I felt like I actually slept, which is strange. But I did. I felt rested. And I have so much energy that it's crazy. And I think it's because I just felt bad for so long. I didn't realize how intense the fibroids were and how they were making me feel until they were gone. So you are going to feel amazing. Your energy levels are going to be up. You will have a doctor's appointment 1 week after your surgery. So your 1 week pull-out doctor's appointment. So I'm going to talk about some things that I wrote down, questions that I have for my doctor, and then I'm just going to share some things with you as well. But feel free to start making your list of things that you want to ask your doctor. So the one thing that I did ask was if I could have pictures of my fibroids and uterus after the surgery. So if that's something that you like to have because you're just crazy like me and you like to see gushy, bloody stuff, then let your doctor know. So I have those photos. The fibroids, from what he said, they were the size of baseballs, and I had 5 of them. So they weren't all the same size, but the majority of them were pretty large, okay? And so, of course, if they're all in my uterus, the uterus is stretched out and enlarged, and the uterus weighed, because I asked this question too, well, how much did my uterus weigh? Almost 2 pounds. So it was basically like I was 4 months pregnant for like 3 years or something. I don't know, crazy. But no wonder I didn't feel great. So that makes sense. So you can ask that question. Also, they're going to give you the results from your lab report. So they test all of the fibroids to make sure that they're not cancerous. So I pray to God that none of yours are cancerous. Mine were not. So that was a huge sign of relief. Again, my ovaries are still intact. They did not have to remove those. So those are still there. Pain medication. So I've kind of tapered myself off in a sense, because as you know, for the first 3 days I was on the oxy, and then I went to ibuprofen and Tylenol. And I'm still doing that. So I plan to do the ibuprofen in the morning, Tylenol halfway through the day. So it's ibuprofen 800, Tylenol 500 halfway through the day, and another ibuprofen at night. Next week, I'm going to take that Tylenol out and just do that, because that'll be like week 2, and just do the ibuprofens. And then the week 3, I'm going to try to take 1 ibuprofen a day. And then hopefully by week 4, I'm totally off. Do not go off your pain medication. I don't care what nobody's telling you, okay? If you want to taper back or switch like I did, you can watch the other videos, and I talked about how I did that. But you kind of test it out, but don't go completely off no pain medication. You're going to think that you feel good and you're fine, but you still got cuts and tears and stitches and stuff on the inside, okay, that need to heal. Discharge and bleeding. You will, some people said after a few days they didn't have any discharge, any bleeding. So that could be the case. It is normal to have discharge. It is normal to have some light bleeding. Nothing that takes up more than a maxi pad in a day. So if you're bleeding through a pad, you need to go to your doctor, call 911. That's an emergency. But if you're having spotting and you're having some bleeding, light bleeding, it's usually like a light color. A lot of that discharge is coming from the stitches, because you have that vaginal cuff. And so that's healing from the inside. And as that's healing, you're going to get that discharge, which is fine. As long as your discharge does not have a foul odor, you're good. If it does, that could be a sign of infection. So you want to talk to your doctor about that. So my sutures, again, I have a cut. It's the belly button, and then there's 1 incision on each side. So it's a total of 3. I didn't have to get cut anywhere else. Those sutures are healing absolutely fine, remarkable. I did have some drainage from the belly button the first few days. And then after like that third day, it stopped. I didn't have any drainage from the scars on the sides that have the liquid tape or whatever. I didn't have any, the tape is kind of still on there. And I didn't have any problems or bleeding from that. Driving. So I am driving. I started driving probably, I don't know, day 4 or 5. Not that I recommend that. I'm not a doctor. I just kind of listen to my body, and I need to take my kids to school. So it's a straight shot for me. And I'm smooth when I drive. I'm so smooth. I don't do a lot of twisting, turning, bending, jerking. I don't slam on my brakes. Like it's like you gliding, like you going to space. That's how I drive. I'm just saying. I'm gonna toot my own horn. Thank you, mommy, for teaching me how to drive. So anyways, you can drive. That's fine. Just don't do a lot. You know, I go once or twice out of the house, just a short, quick errand, and then I'm back. My doctor said it was okay to travel. So I asked him, you know, hey, can I fly? You know, get on an airplane. He's like, oh yeah, where are you going? I'm like, nowhere. I'm just asking if it's okay. Okay, so he's like, oh, yeah, it's fine if you travel. Again, you want to take it easy. You definitely want to, this is just my suggestion because you're at a high risk for blood clots after a surgery. I would not travel on an airplane until weeks. That's just me personally because you don't want to risk it. On that note, let me let you know this. They're going to do blood work, right? So when you go to that 1 week appointment, they're going to give you the results from that too. So my D-dimer number was high. You're probably like, what is that? That's basically something that they measure through a standard blood test after surgery. And it's usually high the day of surgery and a week after surgery. So don't be alarmed if that number is high unless you're having some serious symptoms. Blood clot symptoms would be like pain or swelling in the legs or any other pain or swelling in other places. It would be like shortness of breath. You can look it up, whatever the symptoms are, okay? And so you're at higher risk, especially that day 1 of surgery. That's why they want you to get up and walk around and move as much as you can to prevent blood clots and to prevent pneumonia. So just knowing that, like once I found that out, I was like, I will not be flying or traveling anywhere. So you can decide or ask your doctor about that. Constipation. A lot of little YouTube birdies told me that constipation is more painful than the actual recovery from the surgery. So I will say this. I prepared. So if you have not watched my first video on what to buy and prepare to have for this surgery, please do that because I mentioned prune juice and Miralax. Those are things you want to start getting on right away. Now I've kind of switched from that to something a little more natural. So after a few days, I switched to Smooth Move tea. That is amazing. So I would say take it every day. Have you a cup of Smooth Move tea every night before you go to bed. I have not had any constipation issues. And then also if you want to take that prune juice every day, along with that, you should be fine, especially if you're not eating really, really crazy. You know, eat those soft foods, those single ingredient foods. Make sure you're chewing things up. Stay away from the sugars and the carbs. Those are the things that constipate you. And then you'll be okay. So exercise. That was my next question. When can I get back to Zumba? He was like, never. No, I'm just kidding. He said, you have to wait on that. You can't be doing Zumba. He said, you can walk. Okay. Moderate pace. He said I could do some power walking, but you know, I didn't want to risk it. I took a couple of walks the last couple of days and I just said, okay, I'm just going to do what I feel I can do. And if something hurts, then I stop. So I just took some quick 15-minute walks. But you can ask your doctor about exercise. He said that I could use the elliptical for a short period of time. No weights, no heavy lifting. You don't want to lift anything over 10 pounds, you know, no kids, no weights, no milk, none of that. Don't lift anything heavy. And then the last thing that I'll talk about here is, sorry, I'm looking at my notes, sleep. So my sleep has been great these last couple of days. Amazing. Do not sleep on your stomach. No time, never. After this surgery. No. If you tend to roll over to your stomach while you're sleeping, sleep against the wall, prop yourself up with a pillow, sleep in a recliner, whatever. Do not sleep on your stomach. That is a big no-no, okay? So you can sleep on your back. You can sleep on the side. If you sleep on your side, make sure you put a pillow in between your legs so you can take that weight off of your back. And that way your abs don't have to carry that extra weight as well. So you can prop yourself up on the side. I sleep on my side pretty good with a pillow there. And let me just in this video by saying this: you are going to be just fine. I know a week ago I was scared to death. I didn't know what to expect because I watched all the videos. I even watched the surgery. Don't do that. Do not do that. Please don't do that. But everything's going to be fine. This is a really standard procedure. It's something that the doctors do all the time. Prepare your body as much as you can. Strengthen your core. Like I said in another video, that was one thing that I, regret, was that I didn't work on strengthening my core up just really good, at least for like 30 days before. But it's okay if you didn't. But just be encouraged and know that these are professionals, trusted professionals. Everything's going to be fine. Pray over the surgeons. Pray over yourself. Keep a positive mindset and visualize. Before I went into the hospital, the surgery room, I visualized myself coming out and not on a stretcher, like coming out, sitting up, walking around. I visualized myself going home and seeing my kids and like recovering from this. So you want to see it first in your mind, and then you'll start to believe it, because a big part of this healing journey is the mind, right? And even before I go into the doctor, I'm the most optimistic person in the world. So I'm always thinking that there's a solution to every problem that we have. There's a spiritual solution to every problem that we have. And I come prepared with that. It's like, I'm not going to have a sense of defeat. So you're going to get through this. You're going to feel better. You're going to be stronger behind it. This is going to be one of the best things that you've ever done in your life. So I pray that you don't have any anxiety about this. The best thing that you can do to help yourself is to prepare for this. Line up people that can come and visit you once a day and bring you the things that you need. Get those groceries, clean your house, prepare your kitchen, get your car serviced. Oh, go get a pedicure. Yes, that's what I did. I went and got a pedicure. I got some things waxed. Not down there. Don't wax that. They don't want you doing that. Under the arms, legs. Got a pedicure. Got my eyebrows waxed. I don't do nails. I don't think you can have colored nail polish during the surgery. I've heard that. So just, don't spend your $90 on the gel set if it's a dark color. I think it's got to be like a French tip or a nude or something. I don't know why. Okay. But anyways, treat yourself. Buy a couple of candles. Buy a nice new pillowcase for yourself. Do something nice for yourself as you are preparing for this surgery. Okay. And everything is going to be fine. I promise you that. Look at me. Look at me. Go back to day 2 or day 3 and look at me now. Okay. And it's just going to get better and better and better. So I pray that this video blesses you. All right. You stay encouraged and know that you got this. Blessings.
We blowing up airwaves like renegade. Shy boy, mellow man. Oh, you in the right place. Shy boy, mellow man. Turn into a new page. I'm like a little bird in a little cage. You couldn't